Welcome to the GSK Vaccine Recommendations video. Today we'll walk through one of the most important parts of a pharmacist's job, the patient consultation. In this video, you'll learn about motivational interviewing and how to tell a personal story when you're having a conversation with a patient. These approaches can help you to increase awareness about the importance of vaccination.
Initiating the vaccination conversation starts with getting to know your patient. From understanding their knowledge of vaccination, to addressing potential misconceptions about vaccination, and explaining why protection against disease is important, we'll arm you with effective ways to engage your patients, so you're able to have meaningful discussions.
As you begin the discussion, use open-ended questions to help you understand your patient's knowledge of the subject. This can help you make a more informed recommendation. Use reflective listening when speaking with your patients to confirm that you understand what they're saying. Watch this example.
Do you mind if I speak with you about the possibility of getting a shingles vaccination?
Well, I don't know anyone that has had shingles, so I'm not sure that I need a shingles vaccination.
What I'm hearing is that you aren't aware of anyone that has had the shingles virus, so you're unsure why you should get a vaccination for shingles.
That's right.
Well, I'd be happy to explain it to you. It's important to recognize that patients over 50 years of age are at a greater risk for shingles. In fact, 1 in 3 people in the US will develop shingles in their lifetime. The CDC recommends that persons 60 years of age and older be vaccinated.
Well, I certainly don't want to get shingles.
Well, I would recommend you consider getting the vaccination today to help protect yourself. But first, I need to make sure that you don't have any contraindications for the vaccination.
There are a lot of misconceptions surrounding vaccination, so it's important to have an honest conversation with your patients about the facts and the benefits and risks of getting vaccinated.
Is it true that if I was vaccinated as a child, I am protected as an adult?
Well, it depends. Some vaccinations are recommended throughout your adult life to help protect you from certain vaccine-preventable diseases. Protection from some childhood vaccines can decrease over time, and new vaccines have been introduced, so you may think you're protected from certain diseases when you may actually be at risk.
One of the most important conversations you can have with your patients is about why vaccination is important. It's critical to discuss the impact vaccination has on your patients, their families, and the greater good of the community. Ideally, if time permits, help your patients understand each disease so they can make decisions that are best for them and their lifestyle. Telling a personal story is a powerful way to be relatable when engaging in a vaccination conversation with your patients. In this section, we'll tell you about different types of stories you can tell to connect with your patients, as well as where to find these stories.
Storytelling is a great way to connect with your patients on an emotional level, so they have a deeper understanding of the importance of vaccination. The use of personal stories without using names and dates and staying within HIPAA guidelines is a good way to bring vaccination issues to life for patients. Another way to make an impact is to talk about the potential severe consequences of some vaccine-preventable diseases. These personalized conversations may help to educate patients about the impact of vaccine-preventable disease and the importance of vaccination. Telling a personal story is a great way to start the vaccination conversation, but finding those stories can sometimes be a challenge. You can draw from your own experiences and use stories from your personal past while keeping HIPAA guidelines in mind.
And ask other pharmacists for their stories. If you don't have a story, use a hypothetical scenario to help illustrate the importance of the vaccination recommendation. These personal touches will help humanize the conversation so patients can make better informed decisions regarding their health. Now that you've learned about motivational interviewing and how to tell a personal story, you can utilize these skills in your recommendations when you're engaging in a patient consultation. GSK is dedicated to providing you with the information and resources you need to help make a positive impact on the health of your patients and your community. Together, let's make a difference in your patients' lives, one vaccination at a time.